So here we are, we're just getting going. And this is the inside of your shoulder. We have there's a little dark spot on the scope, so we're going to get a different scope before too long here. We're just going to kind of get started with this one. And this is the superior labrum, and this is what we would call a type 1 slap where it's frayed. We have to see if it's torn underneath that or not, and we'll have to probe it. The tear extends a little bit posterior here. The labrum should be a smooth gasket, and so we'll work on defining that. You can see how these pieces of labrum will flip in and out of the joint, and it actually goes down and includes the inferior labrum there. So we're going to look at the rotator cuff. John's going to pull down a little partial tear right there, but not a complete tear. And there we just slid out of the joint, so we're going to come back in, look at the superior cuff here, and it looks okay, coming down posteriorly, and it looks okay. So now we're going to drive right in the front of the shoulder, and we're going to make another incision. We'll bring you right back. So this is what we're talking about. This labral gasket should be smooth. John's going to try and just keep us distracted a little bit. This, though, is the anterior labrum, and it's frayed but not torn off. So these are degenerative tears, not traumatic kinds of tears. And now we're going to come in with a shaver, and we're going to make those all smooth again. So we're just having a little discussion here about what it takes to have a repairable tear, and it's mostly that it has a blood supply and it's detached off of the bone. These are ones where it's just degenerative and frayed. At least so far. We're going to get in an instrument called an arthro wand now. Bring it right back. So now we've got a little more fraying underneath the labrum, but John's showing us that when he externally rotates the arm, this doesn't lift off. It's not firmly attached like a 16-year-old. Go back and pull down, John. Just, Go back and pull down. I want to kind of show you how this is cleaned up. So you have a meniscoid insertion of the superior labrum. You also had a degenerative inferior labrum. I want to smooth this down a little bit too with the arthro wand. Your shoulder is not unstable at all under anesthesia. You did have some clicking from the labral tears, but we could not dislocate your shoulder. So your ligament insertion is still intact. We're just going to smooth that the whole way around. We'll flop there. So now, what we're going to do is we're going to look from the front of the shoulder toward the back. We'll bring it right back. So now I want to show you the posterior labrum. It looks good. You have a little bit of chondromalacia, but not bad. We're going to look down here in the subscapularis recess. Try and pull your cannula back just a little bit. See if we can look around the corner here and make sure there's no loose bodies hidden. Very good. We're going to look up at the lateral insertion of ligaments here. And now we're going to go outside the shoulder. So now we're up in the subacromial space, the space outside the shoulder. You can see the acromion bone up above. You can see there's some injection and irritation. You can also see the fraying of the rotator cuff down below, and then the bursa is all this tissue in between. So we're going to go ahead and work on removing some of this inflamed bursa, creating more space. for your rotator cuff. So we're going to kind of work on that now, and we'll bring you back. Okay, let's have a shaver. Well, I think we ought to do that, you're right. Yeah. Can you abduct the arm a little bit, Joe? Yeah. Okay, gently external. Yep, and then gently internal again. We should show him some of this. Let's see. Now you can see your outer surface of your rotator cuff's kind of beat up and frayed. We've got most of the bursa excised so that we can see the outer surface of the cuff. John's going to gently externally rotate your arm. And he's going to gently internally rotate your arm, and what that does is allow us to look at different portions of the rotator cuff. And there are no complete tears. So we've verified that. Now we're going to just excise a little more of the bursa so that we can see real well. We're going to turn our objective like this. And next thing we'll do is we're going to outline the subacromial going up the northern one. And you can see that you do have a pretty big downslope and decrease in the space anteriorly. Now what we're doing is just exposing the bone spur, and again, it does look like it's pretty good size. I know I've taken pictures of the bone spur already, but this is a better picture. We're going to get the Arthur one more time, and then we're going to go in, come in with a burr, and we're going to flatten that to give your tendons more room. So things are going well. And your joint is cleaning up very nicely. Now we'll come in with the burr. And with the burr we'll take off this spur. We're just going to keep working until we get this flat the whole way. We're using your pre-op x-rays as kind of a template for how much to remove. We'll bring it back. Just want to kind of show you the AC joint over there. That's the clavicle, just the clavicle. This is the outer surface of the cup. We now got the bone spur completely flat. We're going to look at it from a different angle. We'll bring it right back. So this is the anterolateral acromion. This is the AC joint. We're looking at it from the lateral portal. You can see the spur is completely gone, flat the whole way. So we'll get a picture of that. And then we're going to look down at the rotator cuff. And John's going to internally, externally rotate your arm. Show us a nice intact tendon, healthy muscle over here. So with that, we're going to get you off to recovery. Everything's went really well.